it's 1:30. I do want you to notice that I have pushed the record button. So the training will be recorded for later use. It will be up on our provider portal when we're ready for it to be out there. I want to thank you all for joining us today. We're going to go through the first section of the ICAP. I want everybody to notice that attached to the meeting invite is some documents for your use during this training. For example, we have an ICAP that's fillable. So if you want to follow along, and you can complete this as we go, so you have practice. There is also some documents that are about a fictitious person, so that I can, so that you can, we're going to use that as an example. Does everybody else have an echo, or is it just the one? Okay.
I do not have an echo.
Thank you. I'm going to go ahead and share my screen.
Son, you're no, and all the
Did somebody have something to share? No? Okay. All right. Can everybody see the PowerPoint slide? If
Yes.
not, okay, perfect. Thank you. So this is being put on, of course, by the Division of Developmental Disabilities. On this call, we have various providers. We have our community support providers. We have conflict-free case managers, and we also have some family support coordinators. So I'm going to go through this first part with the new ICAP guidelines, although I'm not thinking there was a whole lot of change in that first part. So the first slide here is our mission, which is to ensure that people with intellectual and developmental disabilities have equal opportunities and receive the services and supports they need to live and work in South Dakota communities. The ICAP was designed to look at the adaptive skills and problem behaviors that an individual may be experiencing during their supports and services. It was intended to help determine the types of assistance that that person may need who has that developmental disabilities, or and to, with the idea in mind that they would be as independent as possible. So that is where we're heading with the ICAP, is to try to define how to help assist that individual. You will find that during the ICAP, or through the ICAP, you'll have 3 opportunities or options for answering the questions that are asked. You will see mark 1, if you can only choose one, of course. That is to find what best describes the individual, or what the individual is most usually able to do. So we're talking most of the time. If we can't say all of the time, you would choose the answer that best describes them, if it's a mark 1 answer. Now, there are times when you're going to be asked to mark all that apply for that individual, and it is clearly spelled out next to the question during the ICAP. So if it says to mark all that apply, you're really looking at that person is comprehensive, and you're going to look at all the responses that might be applicable to that individual. Now, if you're thinking none might apply, you may mark none at that time. And the idea is not to skip any answers. We want to make sure that every question on the ICAP has been answered, so that we know that it's been thoroughly completed and comprehensive. Sometimes it's unclear if you skip something, whether or not it was skipped intentionally, or not marked intentionally, or wasn't marked on accident. So we ask that you always mark at least something. And so even in that mark that apply, you can choose the option to mark none if if it's necessary. Finally, there is the option sometimes to mark other. Now, that should only be used when absolutely necessary. So we really want to make sure that we are looking at the best possible answer or yes, response for that individual. And we want to make sure if it's not the best possible, if there's another one that is close and would describe that person, we would check that one. But if you do choose other, please make sure that you are filling in the line next to it. So all of the questions that you have the option to select other, there will be a line. And what we really want is to make sure that we can spell out what that is so we know what's going on with that individual. We're going to first talk about the front page of the ICAP booklet. In this front page, you're going to complete all the identifying information. And what the caution here is that this information is accurate as it possibly can be. And we do have different opportunities. I know that there are also some DD staff on this call that do the intake part of it. So that's kind of a little different than what the case managers and family support coordinators are going to do. But what we want with all this information is as accurate as possible, and it's verified. So for, of course, the name, we're talking about the individual is the first part. We're asking for that last first and middle initial. And that's their legal full name. So what is how they're identified if a claim were coming in for Medicaid? We want the name that is their first, their legal full name, not a nickname or a shortened name. We need the legal full name as how it would be found on a Medicaid claim. All right, so then of course the address. Now, if they're new to services, of course you're going to use whatever address they're coming in with. But those of us that are on the case managers and family support coordinators, those that are completing this, if they're residing at a facility or residential facility at the time, that's the address you would use. If they're residing in the family home, that's the address that you would use. The phone number, of course, would be their phone number, that person's phone number, if they have one. They may not have one. If they do have one, or if there's a landline connected to the home that they're living at, you can use that phone number. Otherwise, you would use their phone number. If they have a legal guardian and this individual doesn't have a phone number, of course, you would use the guardian's phone number. The residential facility, again, if they are living in a residential setting already, that's the address that you would use for them at that time. If they do not live in a residential facility and are living in a home with family or guardians, you would put NA. If they're an independent adult and they're living on their own and you've already used the address above for them, you would put NA on this line. But again, we want to make sure each line has something written in it, whether it's the actual address, if we haven't already used it, or if it's NA. The next one is only going to be applicable for those that are enrolled in a school or a day program. So school day, if a person is, if the individual is 21 or younger and is still attending school, you can put the school in that line. If they are in a day program, you could put that on that line. If they have an employer, you can put the company name on that line where they're working. If none of those are applicable, then you may mark NA. So the county or school district, this comes into play if there is somebody that is fiscally responsible, financially responsible for that individual. So we know that individuals 21 or younger, if they're in a residential setting, they will have a school that is attached to them for the tuition and match. So you can put that school in that line. If they, in some cases, there might be a county that is involved, or if they're under like a commitment or something, and they're paying, they're financially responsible, you could put that in there. If none of that's applicable, you can go ahead and write NA. So if you go ahead, this is our fictitious person, and that information is attached to the meeting invite. This is what we would look like for this individual who is of school age. So the first and last name we can find on the documentation that is provided. There is a psychological or psychiatric evaluation that's attached to the meeting invite. If you have somebody coming in that's already in services, you may have seen the name might be in their TheraP documents. It might be in the actual application when they did come into services. Wherever, we want the full legal name, the address from where this is an intake person. So this is a person that's not in our services yet. If most of the people that are on this call would have somebody that's already involved in services, so you would have, if they're in a choices residential setting, you would put that in here. If they are in a family support or in the family support waiver and they're living at a home address, that's what you're going to put there. And you will notice that this individual, of course, we have the state, the city, we have a phone number, but this person is not in a residential setting, so we do have none, or it would be none or not applicable. You could write there. They do have a school that they're attached to, which is the Hayes High School, and that is in Delaware. So we're still on the front page of that ICAP booklet. And at this time, we're moving to the next line down, which is the case manager. And we are going to complete all identifying information for that individual. This case manager may be different than, like, it's not just conflict-free case manager. This would be the site coordinator or the family support coordinator, excuse me. If this was being done up at SDDC, their case manager would be in here. So whoever is the person responsible to assist this individual in obtaining, coordinating, continuing, overseeing their services, that's the name and phone number that would be in that line. If our intake people, they're new to our services, this part would be NA because they don't have one assigned yet. All other reasons, though, there should be something in that line. So we move on to the next line, which is the parent or guardian. And this is if the individual is an independent adult, this spot can be marked NA because they are independent adults. Now, if they have a guardian, this is where their information would go. If they're under the age of 21, that is where their information would go. Of course, name and phone number. If it's an independent adult, of course, you would be putting NA because they're their own person. The last one that we're going to talk about right now on this slide is the respondent. So who is completing this? We are asking that this is also completed, even if this is like an annual that you're completing. We really want to make sure all information is on this document. And so if you are the case manager, or conflict-free case manager, family support coordinator, your information would also go in here if you are completing this document. So name, phone number, and how you are in relation to the client or individual. So this is our fictitious example. Again, you'll find this attached to this meeting invite. We already left off with the county or school district was of Delaware. This person, of course, being new to our services and requesting it, did not have a case manager, so there was none, and the phone was not applicable. However, they are under the age of 21, and their parent, Barbara Elkins, is their guardian or parent, and she has her phone number here. And because this was done by our intake team, Stephanie Boujon was the one that did it. She's the respondent. Phone number, how she is in relation to the client. So if you are the conflict-free case manager, family support coordinator, you would put that information here. And then you would go ahead and write a brief summary of why this evaluation is given. This one was given for eligibility determination. If this is an annual look at the ICAP, you would put that in here. If there was, for example, a change in condition, you would write that in there. It doesn't have to be complex. We just need to know why this evaluation was given at this time. So I already talked about the reason for the evaluation. We're still on that front page. Now we're moving on to after we do the reason, which is that brief summary. We're going to move over to the right-hand side in those boxes that are outlined in maroon or burgundy. And these are all the ID numbers that are associated to this individual. So ID numbers are, if we look at the very first one at the top, is called the client ID. This number must coincide with the service authorization, the DD service authorization data management system. So whatever either choices or family support, there will be an ID that coincides with them. The residence ID is a 2-digit number, and that 2-digit number is for the residential provider if they have one. If they do not, you would write NA in that. And each residential provider has a 2-digit code. The day program ID is also a 2-digit number that is assigned to the provider that provides that day service. If they, of course, if they're not receiving a day service, you can write an NA on there. If they have a county or school district, there is a 3-digit number that is assigned to that school district, our county, if there is one. So that would go in that line. Again, if they don't have one, you would write an NA. The case manager ID is a 2-digit number that is assigned to that provider. So that would go on that line. And that could be, okay, and then we go to other ID. And that is any other ID number that's associated with them that is relevant, you could put it there. Otherwise, you may leave it blank. You may not, you'd write an NA, so you wouldn't need to use that. So if you're looking for the ID numbers for providers, counties, school districts, whatever that might be, you may return to the ICAP guidelines, and in Appendix B, you will find those 2-digit codes, or 2 or 3-digit codes actually. So the next box down is the reason is that to calculate the age, because we know the age is related to determining the service score. And so we want to make sure the birth date is accurate, and this must, excuse me, I skipped evaluation date. So we want the evaluation date so the date that this assessment was given will be first, and you're putting it in the format of the 4 digits for the year, the 2 for the month, and the 2 for the day. And then for birth date, where I was already at, we have to verify that that is the actual birth date. So we need to make sure it's verified through a certified copy of their birth certificate. For those that are already in services, you should have that documentation in their file. For those, if you're coming into services, you should be asking for a certified birth certificate so we can get the accurate age. This is not only like their service score, but then it leads into a rate tier for funding. So we have to make sure this one is correct. So after you, of course, get the dates in there, then you would calculate at the bottom into years and months. So for this individual, they were given the evaluation on September 5th, 2024. I realized I forgot to change the birth date, but it would be a different year, but according to this one, it's January 1st of 2023, so they're less than they're around a year old. So just know that that number should have been changed. So you are calculating now based on that information, and they're coming up with their age. Right. At this time, we can move to the inside of the ICAP document, and that is the descriptive information. So it's section A of the ICAP. You will be completing all these sections, and then you're going to notice that the very first one, of course, indicates only to choose one. So you're choosing either male or female, and that would be the gender at birth. Okay, so that's the direction for that one. The height and weight would be given most recent. You usually can find this information to verify it through any medical documentation if they've had a recent physical. It should be included in that on the document for the height and weight. For number 4, race, you're going to only choose one. And the choices that are in the ICAP are white, black, Oriental, Asian, or Pacific Islander, American Indian or Alaska Native, or other. So we are choosing the race that they are most identified with, most associated with, most usually are referenced to for that individual. If you do mark other, there is a line that you need to write down what the other might be. So we move on to number 5, which is Hispanic origin. Now, this one is a Mark 1 option. The first option is not Hispanic, and the second is Hispanic. So again, you're going to choose one that the person most identifies with as their, if they are of Hispanic origin or not. Number 6 in this section is the primary language understood. You will choose one of those. The options are either English, Spanish, or other. Now, this is the language understood. So this would be if whatever that individual most likely uses as a spoken or written language that they're best able to understand. So we know that some of the individuals we work with are in contact with more than one language. So we're going to choose the one that they are most likely to understand or speak in. If by chance they are equally of 2 different languages, it's an equal, they use both equally, understand both, then you can go down to other. You could select other, but on the line you would put what those 2 languages are. But again, the one that is most often, most understood, one that they're most around. So then we would move to number 7, which is the primary means of expression. This is a choose one option. Number 1 is none. Number 2 is gestures. Number 3 is speaks. 4, sign language or finger spelling. 5, communication board or device. 6 is other. So what we're looking for here is the one that describes the way the individual is most effective on their communication with other people. So we have to make sure we're looking at how they're effectively able to communicate. So we were real careful with that we think that sometimes they're speaking, but they're not really understanding what we're saying. So they also use gestures. So gestures actually is the one that they're actually understanding more of. I'm going to choose gesture. The one that they use are most effective with communicating. So if you're moving down, like if you're looking at communication board or device, we know that there are various types of mechanical or assistive technology that can be used. So if you choose that one, there is this line that we would like you to indicate what it is that they're using. If if there's something that's not mentioned here that you would choose other, then of course, again, on that line, you would mark down what that is. So, and I like, again, I know that most people or some people have several different types or modes of communication, and we were choosing the one that is best represents how they're able to communicate. So number 8 is marital status. You're choosing one option. It's either never married, married, separated, divorced, widow, or widower. You're going to choose one of those. And this last one on this slide is legal status, and you are choosing one. And this is the one that must be verified. Well, all of this should be verified. We want to make sure that we are putting the most accurate information in for this individual so this document can be used with fidelity and integrity. So on number 9, you're choosing one. Are they a legally competent adult? Number 2, is their parent or relative is a guardian or conservator? Number 3, non-relative is guardian or conservator. Number 4, state or country is guardian or conservator. And number 5 is other. So if, or while we're in this one, again, we're consulting our records. If we are choosing anything other than the legally competent adult, we are looking at guardianship papers. And so we must have those records to verify that. If you choose, if you're choosing, for example, other, that one could be tribal guardianship. There might be a power of attorney that's associated with this individual, and you're going to include the power of attorney type or reason. But otherwise, you have the option of one of the other ones. But again, making sure to verify that with the appropriate documentation. So we know, based on the information provided to us, and that's attached to your invite, that Michelle is a female. So we have chosen female. Only one has been marked. And through her physical, she has some medical documentation that is provided for you. In that, you will see that her height and weight are here, and we can look in the document to find that. For the race, she is most associates with, and she is white ethnicity on this. She is not Hispanic. Her most understood language is English. She is speaking, of course, that's her mode of her expression. At this time, since she's under 21, she is not married. And that is why number 9 is marked as legal. Her parent is a relative or legal, is her guardian. Parent or relative is her legal guardian. So I've included this piece of information out of the medical document that was included in your meeting invite papers. And you will see here, this is where we found in there that this was a physical. She had a height and her weight is included. We also know here that Down syndrome is mentioned, but we will get to that here in a moment. All right, so now we're moving on to section B, which is the primary diagnosis for the individual. So on this very first column, number 1, it says right next to the primary diagnosis that you may choose only one. Okay. We are looking to the diagnosis with the greatest degree of dependency. So what their greatest degree of dependency is. If there is no primary diagnosis, which in the cases of everybody on this call, unless you're doing an intake, there has to be a diagnosis in the primary, because they wouldn't be able to be in our services if they did not. And again, we are verifying it. We are looking through the documentations and we are finding that diagnosis. I am not including it if I don't have anything that backs that up. All right. We do not, and I want to caution this one. where the diagnosis would not be included as primary. If it is a provisional diagnosis, a suspected diagnosis, or a history of or a prior history of. So that would mean that it is not given as a primary diagnosis. We're not able to include that. So we know that this individual, Michelle, they're considering her primary as MR, so number 9. We make sure we have the documentation to support that. And in the documents that was included in that invite, there was a psychoeducational assessment completed for Michelle. I make sure it's hers. I look at the birth date. I'm verifying this is her. And then here I look at the evaluation date. Now, since she is under the age of 21, we know that school evaluations are completed every 3 years. And so we do notice that that's what this one is. If it's a person that's in services, we're looking at the date of their evaluation. And more so, we are looking to make sure we're not in the need of a new one. So like if a person is over 10 years old, the evaluation is, approximately 10 years old, it might be time to look at getting a new evaluation for that person, just to update if there's any new conditions that we need to be aware of. So we then go on through the evaluation. We know that she has a full scale IQ of 45. So we know that is important because in order to be considered in a person with MR or ID, they have to have an IQ of 70 plus or minus 5. And so we're yes, we're well below 70 for Michelle. So she has an IQ of 45. We look at the adaptive scores for Michelle, and we know that 70 is the cutoff on that also. And there are several scores within the range for that. And this was completed. This is an ABAS, so that is an appropriate adaptive test assessment. And then in the diagnostic impression of that evaluation, she is given a moderate ID diagnosis. So we have the 3 components, which means we can go ahead and make sure that we, on that number 1, we mark number 9, MR, for her primary diagnosis. Now we can move on to column number 2, which is the additional diagnosed conditions. And this is a mark all that apply. So again, we're verifying these. We shouldn't be including any type of diagnosis or condition unless it's verified through medical or psychological or psychiatric, and this one we do have a vision one that would be verifying this. Of course, for the very first one is the autism diagnosis. We know that sometime there was a change in the DSM, and so that if they have a pervasive developmental disability, that must be before the date of May 18th, 2013. Otherwise, it should be an autism diagnosis in their paperwork. We do look at the evaluations that were used, and so that we know when we're looking for autism there, we look to see what tests were administered for that diagnosis. So some of those would be like there's an autism diagnosis interview, there's ADOS, the CARS or the GARS. We also are looking that it's completed by a qualified professional. So we can't have a gastroenterologist providing an autism diagnosis. We would be looking for somebody that is in the correct qualifications to provide this diagnosis. If we're wanting to choose additional diagnosis of blindness, which would be considering them legally blind, this has to be verified through, and you have to have seen and have this documentation that a visual examination was completed and that both eyes would be in the 2200 area in order to be considered for blindness as an additional diagnosis. Now, for the brain or neurological damage. We have a couple different options that this could possibly be. In order to be the diagnosis of record, of course, we know that primary dose diagnosis, must be before the age of 22. However, if they incur these later on, like Alzheimer's or stroke or brain injury, they do have to be verified through, in some ways, that could be a neurological evaluation. It could be through an MRI. It would be written into the psychological or medical record that is what they have. And we're looking to see that. Okay, and then we have cerebral palsy also. That can be, I should also mention that, of course, any psychological or medical diagnosis needs to be signed by that qualified provider. So if they have cerebral palsy, we see it sometimes in a psychological or in medical, but it's also assigned by that qualified provider. So for Michelle, that's our person that we are using as an example. For her additional diagnosis, that marking all that apply, they didn't have any of those top 5. So we didn't see that in the documentation. So we're going to move on. We do have chemical dependency to look at. That is a chronic alcoholism, chronic drug use. Has some type of addiction to some prescriptions that are not prescribed, or some drugs that are not prescribed to them. Again, we would see some documentation of that. We wouldn't necessarily just take it as somebody says they have these issues. We would need to see that it is documented somewhere. Excuse me, deafness would be a total hearing loss. Epilepsy or seizures would be marked if there's a diagnosis. If there is a history of epilepsy, but they are, or seizures, and they have been very successfully controlled by medication, and we can prove that through documentation, you can mark that one for an individual. There is a point later on in the ICAP where you would need to mark and number 7 in section C for current medications. We would need to mark that their medication is in there. So again, our individual does not have one of those additional diagnoses. So we are going to move on to the next section of those. So we're on number 9 now. In order to be considered for additional diagnosis for MR, again, we're marking all that apply. So they may have MR if they have it diagnosed by a qualified provider, and it has those areas we talked about earlier, being a diagnosis, a IQ score of 70 or below, and the adaptive score of 70 or below. So for physical health problems, in order for this one to be considered as an additional diagnosis, we know that it has to be something that is requiring medical care from a nurse or physician, and that there's a prescription associated with it. And so we would consider these chronic illnesses, and we're going to specify what that illness is. On number 10, there is a line that you can use. Some of those might be heart problems, blood pressure problems, digestive, respiratory, skin, diabetes. Number 11 is the mental illness. This requires a formal diagnosis. Again, formal meaning that it was conducted by a qualified provider, and it is included in their documentation, and it is verified by you, whoever's completing this, that they have it, that you've seen that documentation that verifies this. So this could be something like psychosis, schizophrenia, manic and depressive disorders. So you would mark 11 if you've seen that diagnosed. So not if you heard that or somebody told you that. We're looking to have it assigned diagnosis, or in the files that you have. In the comments section, if you if you don't find there's enough room on number 11, you could write down, this is where you could write down what those diagnoses of mental illness are. And the last one, besides other, is situational mental health problems. So in order for that one to be considered, it has to have, it must distress or restrict the everyday life functioning of that individual to be considered. So again, I mean, you're gonna hear me say it again, there has to be documentation to support it, otherwise you're not including it. Those things can be like an emotional disturbance. They may have some seasonal depression, some anxiety. Again, you would mark it if you have the documentation to support that, and then you would include it in the comments section of what those ones are. Again, if for some reason you choose other, you will need to write down what that other is on the line provided. So in looking at the information that you have for Michelle, our fictitious person, she we have chosen number 10 for her as a physical health problem. And under the comments, you will see that we have chosen hypothyroidism and chronic constipation. Now we have to make sure again that they're requiring medical care and there is something prescribed for them in those two situations. Also marked is other for this individual also has Down syndrome, which was in the documentation provided in with the physical. So we know we can mark that. So in the documentation, we know that the person, here's the Down syndrome and the hypothyroidism, the chronic constipation. We know by right here that levothyroxine is prescribed for the hypothyroidism, and that is the instructions for that one. We also know further down in the document that they're receiving a Miralax oral powder for their chronic constipation. Again, this is all within the physical that they receive from the doctor. All right, so now we are on the last section for today, which is section C, the functional limitations and needed assistance. So the first one we're going to talk about is the level of MR, level of mental retardation. We're only choosing one. So in order for one of these to be chosen, it has to have been either the primary or the additional diagnosed condition. Otherwise, our CompuScore will not score that. So even if we see an IQ in the documentation in the psychological, and they had an IQ of 52, we cannot include that unless there was a diagnosis. We have a diagnosis for a primary or additional diagnosis. So remember, it has to be diagnosed, and it has to be in the psychological. If they have it, they must have the IQ and they must have the adaptive to be considered in this section. And okay, so those are the options. We're only allowed to choose one. If you do not have additional or primary diagnosis of ID or MR, we would not mark this. We would either put number 1, which is not mentally retarded, or number 6 is unknown, delayed, at risk. So for excuse me, here's our example. So because our Michelle has the diagnosis, she's diagnosed as a primary diagnosis of MR, we are able to mark number 3 for moderate. We know that her IQ is in that score between 36 and 51. For vision, we're only allowed to choose one. The options are listed here. So Michelle either sees well, she may wear glasses, she has vision problems that limit reading or travel, or she has little or no useful vision. So the important thing to note here is we may be acknowledging the response, based on the fact that she is using glasses. So that's her aid, that we are going to rate her functioning with the use of glasses. So we're going to choose 1. And at this time, we know that Michelle sees well. She doesn't have anything in her documentation that suggests that she is wearing glasses or needs glasses. So we have marked sees well. For number 3, which is hearing, we're choosing 1. These are our 3 options to use. Hears normal voices, hears only loud voices, little or no useful hearing. Now, we are going to again mark the functioning of Michelle with the use of the aid. And we're talking about how it most accurately describes her hearing. So if she uses a hearing aid or some other type of prosthesis to function with, we would rate her function with the use of that. So if they hear well and they use a hearing aid, then you can mark this one. So it's a marked 1 again, and Michelle, there's nothing in her documentation that suggests she even needs a hearing aid. She hears normal voices. Frequency of seizures is number 4. We will only be choosing 1 of these. The options are listed here as none or controlled, less than monthly seizures, weekly or more often. That should be not of, more often. Excuse me. So through documentation that has been collected, we are going to utilize the one that best describes them. So you are looking to see how this person is doing, if they are a person with seizures or epilepsy. So I should be able to look at the documentation and be able to tell that they have it weekly in order for me to choose that one. If, of course, they do not have epilepsy or seizures, then I'm going to choose none or controlled. Michelle is lucky. She is a fortunate person. She does not have any seizures at this time, so we are going to put none or controlled. Number 5 is health. Again, we are choosing 1. The options are here. No limitation in daily activities, fewer slight limitations in their daily activities, or many are significant limitations in their daily activities. So we are looking at their documentation from a physical, and we're also looking at their day-to-day activities and if their health is affecting it. If there is nothing at all that is affecting them, there is no kidney issues or heart or lungs that's affecting anything they're doing, then I'm going to write no limitation. I'm going to check no limitations. But if they're not able to do as much because their lungs are not working, they're on oxygen, they're not working at capacity, and they're not being able to be as active, I might choose fewer slight limitations in daily activities. So Michelle, again, she's lucky. She has no limitation in her daily activities. Some more examples of this is if a person maybe on no limitation, they have allergies, and they may have a weekly allergy shot, but and so because of that, they might not like to be outside for long periods of time in the spring, the fall. I might mark that as a fewer slight limitations in their daily activities. Or I might, if they're not a person that actually spends a lot of time outside anyway, I might mark no limitations because it's not bothering them because they're not outside. So again, very specific to the individual. If they have diabetes, for example, and due to that, they have some poor circulation in their feet. And so working is, them being able to continue working is hindered because the circulation in their feet, and they're needing to sit down to work. So that might be it might be fewer slight limitations in daily activities depending on what they normally would do, or it could be many or significant. number 6, which is the required care by nurse or physician. This one, we have the options of less than monthly, weekly, daily, and 24-hour immediate access. So this is going to be marking 1 that indicates the intensity of the health care that's required. If they're only receiving annual exams and that's their only contact with a nurse or physician, we would be marking less than monthly. These tasks, these nursing tasks, are based on whether they can be delegatable, and it's based on the need of what they have and not necessarily where they live. So if they're needing often blood tests for medication monitoring, you would consider how often they're having that done, and that might be a monthly thing, so you would choose monthly. Again, though, you're going to have the documentation to support that. So if somebody were to come back and look for that in their files, I'm going to be able to tell by their MAR or in their ISP what their level and why they're needing in that type of care. So Michelle has less than monthly. She actually only needs to have an annual physical, and so that's the only required care she needs. So number 7 is current medications. We're going to mark all that apply. Okay, and so these you are going to go ahead and on the line next to them write what that type of medication is, and of course if they have none, then you would choose none, but you may have some for health problems. So if you have some heart issues and you're taking a certain type of medication for that, I would choose that and I would write that on the line, and I'm going to include the dosage also. We have many individuals on our services and supports that have some problems with sleep or anxiety. We are going to choose that, and we're going to write that and their dosage on the line. Again, with epilepsy, if we chose epilepsy or seizures as their additional diagnosis, this definitely has to be addressed. But it can be, you could choose that and say VNS though has this under control. You're going to state what that is, or if not, and they're needing continual medication for that. This other would be chosen if they have some over-the-counter type medications that anyone can go and purchase. So we would put that there. So that might be like ibuprofen. You could put that in that line. Unknown should be only used if we really don't know, but we're going to try our best to find out what their medications are. And that should be found also within their documentation in their MAR, or that would look, or whatever system your provider uses to track their medications. Some of them have some different programs. So we know based on what we marked as the additional diagnosis from Michelle, and it was verified through her physical, that she does have she has some health problems. And so down here, she takes levothyroxine, and this is her dosage, and that is the reason she's taking that. Miralax is also here. That's how much is taken and what it's for. And then for number 8, arm hand, we are choosing 1 that is applicable. So no limitations in daily activities. Some daily activities are limited, or most daily activities are limited. This is what most accurately describes that individual's arm hand limitations. If they do use some type of aid or prosthesis, you would rate their functioning with the use of that aid. Mobility, which is number 9, and you're choosing 1. They either walk, they does not walk, they're limited to the bed most of the day, or confined to the bed for most of the entire day. So this is for the largest part of the day when they're going from point A to point B, is how you are marking this one. So we do have people that use walkers and wheelchairs. And then, so you're going to be looking at what the mode they use most throughout the day. And then that's the one you're going to choose. And that's from getting from point A to point B. Again, that documentation should be in there. If you look in TheraUp, you'll see it in their ISP or the ISP agenda. Some providers also just have assessments that they complete annually, and it's in there. So there should be some documentation to support the choice that is made. And then finally, number 10 would be mobility assistance needed. And this one is all that apply. So you can choose more than one. And these are your options of none. Needs assistive device like a cane, walker, or wheelchair. Occasionally needs help of another person. Always needs help of another person. So you're going to choose all of them that apply. So it might be a combination of they need assistive devices to move, to be mobile, and but they also need assistance with transfers from staff. So I would choose both that 2 and that 3 for the individual. Now, number 2 provides the opportunity to write something in there, and there's also a comment section. So best if you can go ahead and put as much information in there so everybody can understand what that person is needing for supports. I did put this in here just as making sure we understand that the documentation that we're looking at or using as verification must be assigned qualified professional. And these are just some. So we got a psychologist, we have a medical doctor, there might be a psychiatrist, there might be if we're looking at the vision, that would be an optometrist. But we need to make sure that that is included. And for an example, for Michelle, we did include this because we see sometimes that a CNP is signing for the diagnosis, but it really needs to be a medical doctor that is signing. So for our, and then that was an example for the physical, but for the actual psychological, we have assigned fictitious school psychologist here, and that documentation is included. One of the things that I often caution people for is that we're not using progress notes or genetic testing for diagnosis. Those are documents that can be used as related materials, but they're not where we get the diagnosis from. So today, if you have questions after this training, you may contact myself. Stephanie Brujon, she is the Dakota at Home Program Manager, and her contact information is here. Heather Burden is our Intervention Support Specialist, and her information is here. And we welcome any questions that you have. You may reach out to us individually. And unfortunately, I don't think we have any time for questions at this moment. Yeah, I do thank you all for attending. Please reach out to one of the 3 of us, and do know that this will be provided. It has been recorded and will be out on the portal. We do have the next training already scheduled, which will cover the adaptive behavior section. And so that is scheduled for later, I think it's the beginning of November. But please reach out with questions if you have any. Thank you.